Hello everyone, this is a brief video on the new strain of COVID-19 that has been identified. There's a lot of discussion happening in the news circles about the new variant, JN1 variant, which has been identified, and a lot of apprehensions regarding the morbidity, mortality, and the risk of infection from this JN1 variant. Let us now talk about the latest information that has been, given out by the World Health Organization as well as the government agencies regarding this new variant of COVID-19. Well, now JN1 is an offshoot of the Omicron variant of COVID-19, which is BA2.86. It has been named as Pirula by the media. It is of low risk to the public health as envisaged by the World Health Organization and the governmental agencies. It increases the burden of infections, especially respiratory tract infections in winter. Now, this infection has been identified in September in 12 countries. So the previous infection of Omicron was the one which caused pandemic in the third wave of COVID-19 a couple of years back. Now, how do you identify this new variant? It is a common symptoms of COVID-19 like fever, cough, shortness of breath, loss of taste or smell, etc. How do you make a diagnosis of COVID-19? Again, the same investigations of RT, PCR, as well as antigen detection testing. These are the two things that are used. So whenever you have a patient who's coming with general flu-like illness like fever, cough, cold, and loss of smell and taste, you can think of COVID-19 with the new variant. Now, how do you treat? The treatment of COVID-19 with JN1 remains much the same as the previous ones because it has got respiratory tract infections, because the immunity is at stake. You may have to treat depending upon the symptoms as well as the stage of illness and the respiratory involvement, the presence of other thrombophilic states, etc. The current guidelines would pretty much suggest the same thing. The main purpose of this video is to talk about what the general public should know about this. So, what about vaccination? There is no need to panic as per World Health Organization, since the vaccine that was previously recommended during the previous um, pandemic pretty much remains the same, because the same virus with a small mutation in the spike protein has caused JN1 variant. Now, all the vaccines that are previously given are targeting that spike protein only, and hence the previous vaccines would very much work for the new strain of Omicron as well, and hence patient don't have to fear about the new variant that has come into picture now. Now, what about the safety protocols? Earlier, we were following the restrictions like hand hygiene, maintaining distance, mask, etc. All those careful measures which will prevent the spread of infection have to be maintained, because it has been identified that JN1 variant of Omicron spreads very quickly and hence increases the burden of respiratory illnesses, and depending upon the morbidities or comorbidities the patient is already having, like the patient who is on immunosuppressive drugs, patients who are having previous illnesses of respiratory system, and those who have obesity, those who have diabetes, those who are on chemotherapy, etc. These patients are at increased risk of morbidity and mortality, and hence it's always better to prevent the infection, and hence always follow the hand hygiene, wear a mask, maintain social distancing, do not go out until it is absolutely necessary. Now, these global measures will have to be followed just like we were following previously. Regarding vaccination, those who are at increased risk better go for another shot of vaccine with the same previous vaccines that we have been taking. Take care.